Hello, everyone, and welcome to Transmissible, a public health podcast. I am your host, Jessica Stahl, and I have spent most of my career as a contractor with the Centers for Disease Control and Prevention. First, working with dangerous and rare pathogens in the laboratory, then traveling internationally with CDC to train scientists in rare bacteria identification. I then worked on the emergency COVID-19 response on the laboratory and testing task force, working on health communications and with the media. I also have my MPH from UAB with a concentration in epidemiology. And welcome to my podcast. This is where we cover every public health topic under the sun, or we plan to, from historic outbreaks, dangerous diseases, leaning a little bit more into the infectious disease side, but also touching on topics like public health challenges during wartime, phototherapy for newborn babies. That one had more of a global health aspect. Modern topics like vaccines and autism, measles, just really trying to stay with our new schedule of the first Monday of every week, leaning more into a modern topic like the vaccines and autism, measles, etc. And then the third Monday of the week or of the month, leaning more into the historic side of Transmissible. I love this part. That's what today's episode is. And that just really combines my love for science, public health, and history. And this podcast is basically where I brain dump a topic that I have deep dove, I guess. And then I just kind of upload it. I like to say I would be doing this anyways, even if no one were listening, but I am very grateful that we are building such a global and big community of curious and smart, data-driven people, and this has just been so fun. Welcome to my listeners from over 48 different countries. Most episodes that ticks up a little bit. So welcome to anyone who's newly watching. This is my second video upload. This is a newer aspect. Usually I was just doing audio, and now I'm doing video as well. So hello, if you're watching on Spotify, you can see me, and then I'm also uploading these to YouTube. And so if you're watching on YouTube, you can see me. And yeah, I'm really excited about today. If you are in public health or even just medicine or science in general, you have probably heard of John Snow, or at least about the Broad Street water pump. Maybe I've heard John Snow referenced in lectures, grand rounds, presentations, TED Talks. He is considered the father of epidemiology. He's also a bigwig in the world of anesthesiology, and so we'll touch on that. But I really want to just go through a little bit of his professional life, talk about the things that he observed, the changes that he made in his day and time. We're back in the 1800s, and how we see those influences in public health today. A lot of what John Snow, like the avalanche that John Snow started, we see today. And I think it's really helpful to look at the past in order to understand the future and the present day public health policy decisions, communication decisions, why we even look at things the way we do. What is gumshoe epidemiology? It was used by John Snow. It's still used today. And we're just gonna get into it, and hopefully my audio is working. It looks like it is. And yeah, welcome to my office. One of the cool things about video is that you can see where I record from. So this is my office. This is my little podcasting corner. We have kind of like our bigger desk over here that my husband and I share. And then this is like my cozy corner of podcasting. It was like really important to me that it was a cozy corner. So that is where you are. You are joining me. So grab your hot beverage, your cardigan, get cozy, because we are going back in time, and we are going to look at the decisions and policy changes of the past and how those are impacting us now and will in the future. Okay, so like we were saying, public health did not begin with COVID-19, grand declarations, or new scientific theories. It is not a modern science. It is not a modern study. But what I see, especially online, is a lot of people think kind of like, oh, they got away with COVID. Now they're enforcing this, or like, oh, masks are back. And it's like, I click on the story and it's, masking in a hospital in a different country. I'm here based in the US, and it's because there's like this crazy respiratory illness outbreak going on. And I feel like there needs to be, among the general public, it would be really nice if there was more public health history that was understood. And I think it would help people add the nuance and the context to the current situation. Now, I agree things definitely changed, and kind of there was like a vibe shift after, the COVID-19 pandemic. But what it really did is it brought something, it brought these theories and these policies and the concept of epidemiology to the front step of the world, where those of us who are already working in public health, it's like these things were, we were already familiar with epidemiology and policy and quarantining and outbreak management and, what a DRPH is. So many people are like, what is a DRPH? Because, a lot of the people who would go on the news or would be, at a policy meeting had a doctor of public health or were a doctor of public health. And so it really brought stuff to the forefront, and nothing happens in a vacuum. So I think one of the things that is important to me about this podcast is sharing the history of medical science and public health in order for us to see the current time in an appropriate context and have some nuance to it. So that is one of my goals with this podcast, and today's episode falls directly in line with that. So kind of be thinking about that as we're talking about Jon Snow. So public health did not start recently. It did not start on a stage. It did not start with COVID-19. It really started in old cities that were crowded and they were filthy. We're going to talk about what a cesspool is. And these thinkers of the time, whether they were physicians or just observant people, a lot of them were physicians, but not all of them. One of the stars of the Broad Street pump story was a clergyman who initially was skeptical, and then he was all in because, he was into the data. The data was convincing, and that is something we also talk about on this podcast is, data is so important because it takes out a lot of the biases and the what word am I looking for? It takes out a little bit of like what is popular, the politics of it. It takes out what is the popular way to think about something, and it just cuts straight to the reality of it. So we've got some characters who appreciate that in the story. All right, so without further ado, let's just jump right in. So it's the early 1800s, and at 14 years old, Jon Snow left home to begin an apprenticeship with William Hardcastle, a surgeon apothecary in Newcastle upon Tyne. His training was strict and immersive. John walked the wards of the Newcastle Infirmary, seeing firsthand how illness moved and how horrific these infectious diseases were in person, up close in person. Apprentices were expected to follow very rigid moral rules. No drinking, no gambling, and no marriage. Jon Snow embraced even more discipline than required, though. He was all in. He abstained from alcohol entirely. He avoided meat. He became a vegetarian and preferred distilled water when he was able to get it. And this choice is really interesting because it really just reflects his lifelong instinct for caution and precision and purity, especially with that water. 4 years later, cholera reached Britain for the first time, and it starts ravaging Newcastle. It's part of the early outbreak. People aren't very familiar with it. And the mining village of Killingworth, which is just outside the city, suffered a devastating outbreak. Jon Snow, still an apprentice, helped treat these victims. And this is something that would stick with him for his entire life. The experience exposed him to a disease that killed with extraordinary speed and left no clear pattern that fit the medical theories of the time. People did not know how to react to cholera. It was just this mystery that arrived on the banks of Britain, and they were learning to deal with it. kind of in real time. So you have this mining town, it's getting ravaged, and there's just a very high level of poor sanitation. And this did not escape Jon Snow's observation, even though he technically did not have a formal background in medicine or the history of cholera. He was this young apprentice, but it stuck with him, and the puzzle just really, it stuck with him, it gnawed at him. When the epidemic subsided, local physicians in that area founded a small medical school. Jon Snow, with 5 years of hands-on experience and fluency in Latin and Greek, this guy, he went all in. He learned Latin, he learned Greek, he doesn't drink, he doesn't gamble, he's a vegetarian, he drinks distilled water. He is he's ready, right? He became one of the first students. He was one of 8 first students. Think of how excited he was. So he goes, if he wanted to further his study, they didn't do, undergrad and then medical school like we do now. He had to further his study beyond this small medical school. And in 1836, he began this long journey to London. First, he visits relatives in Liverpool, and then he walks 400 miles to London. There he enrolled in the Hunterian School of Medicine, located on Great Windmill Street, and rented a very small room in Soho. From this narrow base, in one of London's most densely populated neighborhoods, he began to build the career that would place him at the foundation of modern epidemiology and anesthesiology. At the Hunterian School and Westminster Hospital, Jon Snow gained clinical experience in obstetrics and internal medicine. He then investigated, and this is kind of foreshadowing to just the rest of his life, but as he's in medical school, he investigates this illness that is affecting the medical students who are dissecting the embalmed bodies. So his classmates are getting sick, and he's like, I can figure this out, right? He's really a detective at heart, a disease detective, which is a phrase we still use today. And this was a time when arsenic was routinely used in preservation. So Jon Snow conducted controlled experiments showing that the arsenic vapors were making his classmates ill, and these findings led to changes in embalming practices and highlighted his ability to carefully connect the dots and use the data to produce reform, right? So that is the pattern of Jon Snow's life. He has an observation, he tests it, he collects the data, and then the rules change, the policies change. So Snow finally earns his MD in 1844 and establishes himself as a general practitioner on Frith Street in Soho. So he's a Soho guy. He lives there, he practices there. He lived very modestly. He practiced medicine with methodical care. He was very in tune with the details and developed an early reputation for steady, detailed work. Then anesthesia arrived. So this is the era anesthesia is kind of hopping in the US. It is being heard about over in modern day UK. So when ether and later chloroform began to be used in surgery, many physicians applied them with little understanding to dosage or really taking into consideration how much or how little they were giving. Jon Snow recognized that this was dangerous. He approached these agents very scientifically. He starts studying the vapor pressures, measuring respiratory changes, and he designs this inhaler that allowed for controlled delivery. This was groundbreaking. And this basically happens after he investigated the death of 15-year-old Hannah Greener in 1848. Basically, she had this, what sounds like an ingrown toenail, but she had a toenail procedure done at her house. The doctor shows up. He puts chloroform on a wet rag, and he holds it over her face like this. And unfortunately, she dies. And it was a minor procedure. She probably, if she had had that 20 years before, would not have gotten any type of anesthesia, any type of knockout medicine, so to speak, for it. They use chloroform. She dies, and Jon Snow is just like, this is unacceptable. So he concluded that the chloroform itself was not the problem, but the uncontrolled administration was. And his work in this area laid the foundation for safe anesthetic practice. So if you talk to an anesthesiologist, They know Jon Snow because he is just this pioneer in anesthesiology. If you talk to an epidemiologist, they know Jon Snow from the Broad Street Pump and being the father of epidemiology. But before he was the father of epidemiology, he was a bigwig in anesthesiology. So this expertise eventually brought him to the attention of the monarchy, and in 1853 and again in 1857, Jon Snow administered chloroform during Queen Victoria's labor. So it was her 8th child and her 9th child. And this went viral. The girlies could finally get relief, and the queen herself had given a royal thumbs up. So send it. It's going out. This is how the girlies are going to do it. And that's exactly what happened. From then on, pain relief during labor was no longer viewed as morally inferior, but as the standard of care, an option that you could choose without guilt. So chloroform is safer. People are having surgery, having babies with a significant reduction in pain. Thanks to Jon Snow, Queen Victoria even gives it her stamp of approval. So this guy is living. He is like the guy. Or you would think in London, you would think people would really trust this guy. He's saving the med students. He's saving the girlies. Like, birth isn't as painful anymore. But as we see in life, but as we see professionally speaking in public health and in medicine and science, is you have to just kind of keep proving yourself. People aren't just going to take your word for it, or quite frankly, they shouldn't. You have to keep proving it. And Jon Snow does exactly that with data. So he has all these accomplishments, but his most famous scientific contribution and what he is known for, at least in my world, the most, remains how he used gumshoe epidemiology to save people from cholera. So enter cholera. And it's this disease that he had first encountered as a teenager. His introduction to medicine was watching, people who he probably knew. He was from that small area. These are people he probably knew die from this disease that they just weren't sure how people were getting it. It would just kind of move very rapidly through towns, and it was just very confusing. And the prevailing medical belief was that cholera was spread by foul air. And if you've listened to Transmissible, this comes up in some of our episodes from the past. But foul air, or miasma, was the leading theory of the time, and it makes sense, right? If you have, we'll get into that. I don't want to jump the gun. But basically they thought that you were getting cholera from bad air. Once a cholera outbreak would start in a town, people would flee the town. And it actually did help, because then they weren't there to get cholera, but it was because they were fleeing the foul air. And so this is the theory, but Jon Snow isn't on board. It's just, to him, it has not been proven. So Snow doubted this, and it made him look a little crazy to the medical community, to the elites of his time, to the policymakers. He looked a little crazy, which is, to me, crazy, because he had already proven himself to be such a data-driven, rigid guy. But that wasn't valued quite as much as it is today. So his clinical experience, his observations in crowded London neighborhoods, and his childhood, and his growing familiarity and confidence with medical patterns really convinced him that foul air, he just wasn't convinced. He just did not think it was going to be foul air. So throughout the late 1840s and into the early 1850s, he conducted these now famous careful comparative studies of cholera mortality. He noticed a striking pattern. Households supplied by the lamp. So there's two. We're going to cover the water supply one and then the Broad Street Pump, but this is the chronologically. He noticed that there was a striking pattern happening in London. So households that were supplied by the Lambeth Water Company, which drew water from cleaner upriver sources, experienced far fewer cholera deaths. It was around 37 out of 10,000 houses, which in total during this specific outbreak era was around 100. Compared to the houses served by Southwark and Vauxhall Company. So these were serving the same areas of London, just some people, your neighbor could have a different supplier. So I could be getting Lambeth water, and then you could be getting Southwark water, and we're neighbors. It's just like where the pump was coming, or where the pipes were coming from. So Southwark and Vauxhall Company, which drew their water from heavily contaminated areas of the Thames, had a cholera rate of 315, death rate of 315 per 10,000 houses. That was over 1,200 total. So that is a crazy difference. 37 houses versus 315 houses in the same area, just with different water supplies. So this natural experiment produced some of the clearest early evidence that cholera was waterborne. And John Snow, just think how excited he was. People didn't believe him yet, so it was probably very lonely, but he was probably just so excited that he was finally getting data to prove this, this puzzle that the medical society could not quite figure out. And then the most famous incident, or the most famous story, is this final turning point in 1854 from the now famous Broad Street outbreak in Soho. So there's this cholera outbreak. Basically, Snow is mapping these deaths. The map is now famous. I will put some pictures of it on my TikTok, and in the podcast body of this episode, I will put links. But basically, he gets out a map of the neighborhoods, and he has a pen, and he starts mapping the deaths of all of the cholera deaths. He goes door to door. He's interviewing residents, and he starts to notice some patterns. So he identifies a concentration of cases around this single public water pump. So you have all these neighborhoods, and the deaths are really congregating around this pump. And with the help of local clergyman Henry Whitehead, he traced the likely origin to this, and bless this little girl's heart, this 5-month-old little girl who had cholera. Her mom, they used cloth diapers. Her mom would take the diapers after she would have diarrhea. She would go out to the local cesspool and she would clean them. And what a cesspool is, it's kind of become like what do you call that? Like a modern, almost slang. But a true cesspool is a simple underground pit for collecting raw sewage. And then it basically acts as this holding tank where then the liquid seeps into the surrounding soil. So this was very common, and still people still have these in some countries in the world today. Unlike modern septic systems, which treat the waste first, or like if you have, anyways, we won't get into the plumbing aspect of it, but basically she was washing it over her cesspool, or the cesspool near in her neighborhood, and the cholera from the diapers was getting into it, and then it was seeping into the water supply. Snow presents his findings to the local authorities, who agree to remove the pump handle, except they didn't believe him. They kind of are humoring him, and it's like a little bit convincing, but there are recounts of these meetings where it said literally no one believed him. They thought he was being a little crazy, but they kind of humored him anyways. So in this very famous act of policy, they go down, the city physically takes the handle off the pump so the townspeople can no longer pump water from it, and the cholera cases start to go down. Now, it should be noted that technically they were already going down a little bit, but with the pump coming off, they continue to go down, and, Jon Snow is thrilled. And they still don't fully believe him. It doesn't enact change in a way that you would think. And sometimes the stories kind of glamorize it. That I've heard stories which, if you deep dive, it's just not quite true. Where they go down and they remove the pump, and then there's no more cholera, and Jon Snow's the hero. It's not quite the case. They basically humor him. He's right, but they're humoring him. They take the pump handle off. The cases go down, although they were already going down. Most of the area, or most of the people in Soho had fled, which really helped. And it's just not quite the storybook ending. There's still more to the story, but and that is just so public health, is it not? Like, public health is not glamorous. You're not necessarily going to be like thanked or famous for the people you help, but right? Jon Snow knew he was saving lives, even if those people were really mad at him that they no longer had a water pump so close to their house. One of the stories when he is investigating the outbreak and, he's looking for proof, basically, so there's this, the Soho area around this pump, they're dying from cholera, but there is a brew house, like basically a bar. They make their own beer, and the workers from that brew house, none of them die. There was also a workhouse, and those guys had their own water pump, so none of them died. So you have like, I wish I had the map. In my podcasting tech arc, I need to get like a visual thing right here. But basically, you see all of these cases of death, and then you have kind of these like oases that don't have deaths. And it's the brew house. They weren't drinking the water. They were drinking beer. And then you have this workhouse that had their own pump, and they were not dying. So this really proved to Jon Snow, the people who are using this pump have a much higher mortality rate, but the crews that are not using it did not have any deaths. So another feather in his cap of data proving where the actual source is. There's also a story of this lady who used to live in Soho, but she moved away, but she just loved the taste of the water coming out of the pump. She referred to it as slightly carbonated. And so she would send a girl who works for her down to the pump every day across town to get water from this Broad Street pump in Soho. And she drank it, and I think it's her niece drank it, or her daughter drank it, and they both died of cholera when no one else around them was getting cholera, but they were the ones that were drinking from the Broad Street pump. So there's just so many different things going on that Jon Snow is just lining all up and saying, look, the data proves this, the data proves this. It's very convincing, right? So all of these investigations demonstrate, and Jon Snow himself as a professional demonstrates this new way of thinking, where you observe, you lean on data, you compare, and then you ultimately intervene with the muscle of policy that affects the masses. And this is where public health gets controversial. This is where, when something is done right, there's not a lot of recognition. And when something is done maybe improperly or wrong, it gets a lot of pushback because it's affecting the masses. It's political. Jon Snow is often pointed at as the person who made public health political because, he couldn't go door to door saying, don't drink from the pump, don't drink from the pump. He tries that. It doesn't really work. He had to go to the policymakers in London, and they removed the pump. And it is used as an example frequently in the professional world as kind of just a classic scenario of that. And like I said, it demonstrates just this new way of thinking where it's like, from observations to measurement and studies to data to policy. And that is why he is so famous. Jon Snow was the founding member of the Epidemiological Society of London, one of the first professional organizations devoted to the field of epidemiology. And the seal of the organization, I thought this was really interesting, includes the Latin phrase penned by the Roman poet Perseus from 34 to 36 AD. And I might butcher this, but it's oh my gosh. I should have practiced. I didn't practice this before recording. Veninte accurite morbo, which translates into English as confront the disease at its onset, which I thought that was cool. Jon Snow unfortunately ends up dying in 1854 at the age of 45, the same year as the Great Stink in London, which finally forces London to do a full overhaul of its sewage system. And these reforms really validate his conclusions, but he is not alive to see them really come to fruition. Today, his work is recognized as a turning point in both epidemiology and public health, and his legacy is commemorated each year at the Pump Handle Lecture, where the symbolic removal and replacement of the pump handle serves as a reminder that public health is built on evidence, vigilance, and the willing to act. Snow's classic gumshoe epidemiological methods are still used by the Centers for Disease Control and Prevention and many, many other organizations around the world to track the sources and causes of modern infectious diseases. And in the world of public health and epidemiology, he is an unsung hero, which is just classic for public health. In his time, he was unsung. Now he's sung. Now he gets a lot of recognition, but he was not able to see that. He lived modestly in a modest apartment, really cared about the water quality of his own water, and just really devoted himself to his line of work and saving lives. So that's the story of Jon Snow. I do want to do like a little mini section on what cholera is. We're not going to go into the deep dive of it because this episode was more framed around Jon Snow and how he's the father of epidemiology. But basically, cholera is this intestinal infection. It gives you really, really severe watery diarrhea, severe dehydration. It's a horrible, quite frankly, it's a horrible way to die. And you get it from consuming essentially poop particles that have this bacteria in it, right? So one of the reasons why there was pushback among the people in London at the time was they thought it was just, very ridiculous and kind of insulting that they would be ingesting water that had poop fragments in it, poop particles in it, and there was a lot of pushback there. It is still a big issue today. There are almost 3 million cases of cholera a year, and it's just, there's almost 100,000 deaths, not as much as there used to be because now we know how to treat it, but it is a big issue, especially in parts of Africa and Southeast Asia. It's just been a very painful and scary, very rapidly spreading disease, and clean water supply is one of the main ways for a population to prevent cholera. So I pulled up the CDC website just to give a full overview. So basically, cholera, who is at risk of cholera? It's people living in areas with unsafe drinking water, poor sanitation, and inadequate hygiene are at the highest risk of getting cholera. U.S. residents can get cholera while traveling abroad and sometimes become ill after returning home. Some travelers have gotten sick after bringing contaminated seafood with them from abroad. Usually people get cholera from drinking water or eating food, like I said, that is contaminated with trace amounts of poop from someone who has cholera. But cholera can also be found living in brackish, which is slightly salty, and coastal waters. And so when you eat the raw shellfish from those waters, you can also get cholera. But it should be known, cholera is not likely to spread from person to person with casual contact. So if someone has cholera and people are interacting with them in a casual way, they're not likely to get cholera. If you plan to travel, check if cholera is common or ongoing in the area you're visiting. If cholera is present, washing your hands with soap and safe water, drinking treated water, and getting vaccinated against cholera are some of the steps that you can do to help prevent getting sick. The treatments, if you think you or your family member might have cholera, getting medical attention immediately is really important. Dehydration can occur really quickly, and replacing lost fluids is essential. That's like the trick to cholera. For babies with watery diarrhea, continued feeding them breast milk or formula to stay hydrated. Treatments can include rehydration therapy, antibiotics, and zinc supplements for children. But like I always say, this is not medical advice. Talk to your medical team about your medical needs. I'm just reading this part from the CDC website. So yeah, that's about it. I just think, here's my recap. Let me get a little comfy. I just think when looking at modern outbreaks, pandemics, public health policy changes, everything, it's so important to look at it in the context of history. How have people behaved in the past? How have policies changed things or not changed things? How have they pissed people off? How have they helped instill trust? How have they hurt trust? How have they saved lives, even if it's unpopular? How have they saved lives and it was popular? I think it's so important as modern day public health professionals that we look at the past to help make current and future decisions. And I think it's really important for the general public to have some understanding of scientific and medical and public health history to put things into context, because every time I get on social media and I read the comments under a public health post, it just shocks me. I'm just shocked. And I just feel like we all need more history in our lives to look at current things more accurately. I saw a post about polio, and there was like this huge conspiracy about the iron lungs, and like half the comments were that the iron, okay, this is like a whole other episode. Half the comments were just crazy about the iron lungs, that they were like a conspiracy around those. And the other half was like, what's an iron lung? What is polio? You know what I mean? And so in both of those cases, a little bit of a history lesson would really help make current modern day choices for them and their family, but also, just general consensus, the systems. Also, I have one more point I forgot to talk about. When it comes to the Broad Street pump and Jon Snow wanting it removed, the townspeople were really angry because they're like, this is where we get our water, right? That's fair anger. If I had someone coming over and they're like, hey, I have to take away your water, I would be pissed, right? Now, were there other water options? Yes. But I think it shows the greater systems the greater system at play, and it feeds into the concept of things don't happen in a vacuum. So it was good to remove the water pump. To be a great public health professional, you would recommend overhauling the system, because those people still need water, right? While medical decisions and transmission and point sources are being discussed, people every day are waking up and they need water. And so you're going to really piss off the townspeople if you take away their water, because you're saying this water might get you sick. And so it really feeds into the delicate balance of the general public and their needs and the public health and medical infrastructure. And when a policy is enacted, you have to look at the whole system. It's, okay, we have to get rid of this water pump, but we need to give them an alternative source of water that is just as accessible, because this is a densely populated, lower income area, right? So it really speaks to, there are so many things to learn about the Broad Street pump handle. And I think it's very interesting. And if you have any thoughts, email me at transmissiblepodcast@gmail.com. I love emails. Email me all the time. Just email me to say hi. It's fun to see who and interact with who is listening, and I really enjoy that part. So that is it. I'm wrapping this episode up. This was a little bit of a shorter one, and I'm sure I missed something. Every time I finish recording, I'm like, oh, I didn't talk about X, Y, or Z. So I'm sure I missed something, but thanks for hanging out with me in my office. It's fun. You guys can see me. Let's add some body to the hair. And yeah, I think that's about it. Remember, first Monday of the month is a modern topic. Third Monday of the month is a more historic topic. So that's our new schedule, and we're sticking to it. And I think that's about it. A little personal story time. I went skiing this past week. I try to ski at least once a year now that we live in Colorado, just to keep the skills up. I call myself the pizza queen of the green. When you pizza with skis, you put them in like this. It looks like a slice of pizza. And if you go down the hill, it's slower. You don't go flying down the hill. And I was doing greens. Greens are one level up from the bunny hill, but pretty much as easy as it gets. And your girl was thriving, but it was very scary. I just don't like the feeling of not being able to stop. I need to get used to that. But I skied, my husband snowboarded, and then we gave our 3-year-old his first ski lessons. My husband was in front of him going down the hill, and it was very fun, and we had a really good time. And we got a new cat, Dove. And let's see. That's about it. It's the holiday season. Christmas is in 10. Oh my gosh. It's in 2 weeks. So it's coming up. I hope everyone's gotten their shopping done if you do Christmas. And yeah, I think that's about it. As a reminder, I know I've said this. This is not medical advice. This doesn't represent CDC or anywhere I've worked or gone to school or anything. I don't need the lawsuit, y'all. I don't need it. I hear about podcast lawsuits and I'm just like, ooh, stay away from me. I do not want that in my life. And I think everyone who listens to this knows that this is just, they know how to take podcast information and apply it to their life in a way that is not like medical advice. So you guys are not like that. That's about it. And thanks for listening and watching. If you are watching me on YouTube, I want you to know that this is on Spotify and Apple Podcasts. If you are watching me on Spotify or listening on Apple Podcasts or one of the other platforms, I want you to know that you could also, if it's like an app on, like I like to listen to podcasts in the car, but I also like it when they have a YouTube version because then I can do the app on my phone, or not my phone, my TV. And so like if I'm doing something, I can have the video podcast up in the background. If you like that and you have YouTube on your TV, know that this is on YouTube. It's hard to find me because I just created the YouTube account, so the algorithm isn't like greased yet. Sorry, my eyeliner is like going down. So search Transmissible, a public health podcast. Here's what I recommend. Search like the title of this episode if you are trying to get there. But Transmissible, a public health podcast. Quite frankly, if you search tick meat allergy, that's the first video I uploaded. That's like one of the easiest ways to get to my channel thus far. Once this has been up longer, then the algorithm will be greased and you can just search. But I'm brand new. They don't know if I'm spam or not. So you gotta grease the algo. But okay, now I'm rambling. I gotta jump off. But yeah, thanks for watching, guys, and hope you have a great rest of December, and you'll see me. Is it Jan 1st? Hold on. Let's see when the first Monday of January is January 5th. So you will see me January 5th, and then you will see me again on January 19th. And then you'll see me again on February 2nd and again on February 16th. And then March 16th, that's funny. And then March 6th, April 6th, April 20th. And that's it. Okay, my insulin pump is yelling at me because it's out of batteries. Oh, yep, your girl's gotta go. I gotta plug this thing in. But yeah, thanks for listening and thanks for watching. And I'll see you guys next time. Bye.